everyone, and thank you for joining us today. What you are about to see and hear are excerpts from the PVMA Summit that took place on November 7th, 2020. The topic of this panel was the education for future veterinary professionals in the age of COVID-19. It consisted of a panel discussion driven by experts in the field of education, along with members of the PVMA. As the session ran a full 2 hours, the PVMA has edited it to share with you highlights for viewing as a hot topic session during the Veterinary Leadership Conference. Our goal is to give you greater insight into how education is being changed, not just by COVID-19, but by the demands of our profession and the high standards that our students and their educators have set for themselves. I would like to take a moment to introduce our panelists. Many of you already know Dr. Andrew McCabe, CEO of the Association of American Veterinary Medical Colleges. Dr. McCabe earned his DVM from The Ohio State University and also holds a master's degree in public health from Harvard University and a law degree from the University of Arizona. His resume also includes working for the U.S. Air Force for programs in occupational health, communicable disease control, and health promotions. Ms. Kathy Kaur is the program director of Pennsylvania's oldest veterinary nursing program at Harcum College. Ms. Kaur attended Harcum herself and became a certified veterinary technician in Pennsylvania. She then went on to receive a master's in education from the University of Pennsylvania. Ms. Kaur has been a strong voice for PVMA and the National Veterinary Technician Association, serving as co-chair of the Veterinary Nurse Initiative. Dr. Kathy Michelle is the Associate Dean of Education at the University of Pennsylvania School of Veterinary Medicine. She is a diplomat of the American College of Veterinary Nutrition and is also a professor of nutrition at Penn Vet, additionally holding master's degrees in comparative medical science and medical education. Lastly, I am on the panel, Dr. Christina Doherty, clinical relations veterinarian and assistant professor at Lincoln Memorial University College of Veterinary Medicine, as well as an adjunct professor at the University of Pennsylvania School of Veterinary Medicine. I earned my VMD from the University of Pennsylvania. I am past president of the PVMA and currently serve as the PVMA's delegate to the House of Delegates for the AVMA. It probably comes as no surprise to anyone that traditional education was thrown for a loop in March of 2020. As did other institutions of higher learning, many veterinary schools in the United States, to a greater or lesser degree, transitioned to delivering education via virtual learning platforms. The following are statements from our summit participants, outlining how the education of veterinary professionals has been challenged in the wake of COVID-19 and how it has been evolving even prior to the pandemic to provide students with a broader scope of understanding for the skill set and knowledge that they require as graduate veterinarians. We begin with Dr. McCabe, explaining how the future of education will continue to evolve, just like our profession. You will then hear from Dr. Michelle explaining competency-based learning. Finally, Dr. McCabe will summarize.
So it's no surprise to anybody that the pandemic has had a dramatic impact on all facets of society, including veterinary medical education. The good news is that all of our colleges were able to pivot very quickly in the middle of March to switch to 100% virtual online training and education. This works really well, as you can imagine, for material that is easy to convey in a lecture format or something like that. And in fact, most schools had already been doing much of that. So that was a pretty easy transition. There were some challenges with the more direct hands-on clinical training, but for the class of 2020, it turns out that 100% of them across the board were able to complete all of the required clinical training. And so we didn't have anybody who was left behind. All of that was taken care of. The challenge that we faced was getting ready for the class of 2021 that was getting ready to start clinics in the fall, in the summer. And indeed, by that time, most of the schools were able to have taken a couple of months to get ready for that and get planning. And in fact, with increased use of simulants, virtual reality, and other types of things, they've been able to maintain the same level of training that we got before. In other words, all of the students are still getting the required clinical training. A really important thing to remember as we evaluate that, though, is I am not myself an educationalist, but we have a lot of educationalists in our colleges. And what they will tell you is that the method of training is not always, that's not really what matters. What matters is whether or not you can achieve the competency that you're desiring, the outcome that you want to get. And in fact, there's lots of different ways to do that. And you're going to hear a little bit here from Dr. Michelle about the competency-based framework that we've developed, which has been our guidepost for this event. But basically, there's been a transition across all health professions education over the last several decades, shifting from a knowledge-based curriculum that depends on recall of facts to a competency-based curriculum that allows students to demonstrate competency. In other words, it's outcomes-based. And you'll hear more about that from Dr. Michelle. So that's the kind of the short rundown. Again, the good news is that we're rising to this challenge, and it has been difficult, but the colleges are getting the job done.
Hello, everyone. I'm so happy to be able to talk with you today. I'm just going to give you a very quick rundown on this this concept, if you're not familiar with it already, which you may well be, of competency-based education. Now, as Dr. McCabe already said, that this is a trend that we have been seeing in the education, in medical education now for probably a couple of decades. And we, it's not just in, the training of veterinarians, but also physicians, dentists, nurses, and other allied health professions. And, we probably have in veterinary medical education, we've probably been focusing on this approach to training veterinarians now for about a decade. But really, in the last 5 years, we've made a lot of progress in this area. And that is in part due to an initiative that the AAVMC has supported to help us build a framework for how we would like to create or design our curriculum. And I think I feel really that because we've been moving in this direction, we're probably better placed today to meet the challenges of educating our students in this pandemic than we may have been, say, 10 years ago, if this had happened 10 years ago. So what competency-based education is? It has two components that are important. First is a framework for you to build your curriculum around, and second, and just as important, it's developing assessments, so ways of evaluating learning, so that you can be certain that your students are achieving those outcomes. So it is built around something that we call backwards design. And what's different about creating this type of curriculum is, rather than doing it in the traditional way, where we think about, okay, we need to teach them anatomy, physiology, pharmacology, surgery, rather than thinking about the disciplines or the subject material we need to teach our students. What we do is we step back and we say, what do we want our graduates to know or be able to do? Um, and 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 by starting with the end product, the outcomes that we want to achieve, then we go back and we build our curriculum to ensure that we meet those outcomes. Okay, so this is what the AAVMC has helped us do. About 5 years ago, the academic deans from the mainly the U.S. Members of the AAVMC, the members veterinary schools, got together at the University of Minnesota in the summer, and we talked about this, and we came up with this vision that we wanted to create this framework. And so with the support from the AVMC, we had a core working group of incredibly talented educators from veterinary schools across the US and also abroad, uh, work on this framework with input. I got to contribute a lot. We had workshops and webinars and surveys. So we all worked together to develop this framework of 9 domains of competency. And I just want to, get everybody on the same page by defining a couple of these terms. When we say competency, we're talking about an observable ability of a health professional related to a specific activity that integrates knowledge, skills, values, and attitudes. And here's the important thing: since competencies are observable, they can be measured and assessed to ensure their acquisition. So this is something that we can observe in our students and evaluate to ensure that they are achieving what we want to achieve. And then these domains of competence are broad, distinguishable areas of competence that in the aggregate constitute a general descriptive framework for a profession. So you can see that we came up with 9 domains of competency, and and we shared with you in advance the PDF of this booklet here, as well as a couple of other booklets that this working group have developed. So if you're interested in taking a closer look at this framework, you can do that. So once we had this framework, that was about 2 years ago that this was unveiled. I can tell you that most of the veterinary schools in the country, including Penn Vet, are now doing major curriculum revisions so that we can implement this. But in addition to this framework, what's really important is that we need to be able to not just have these outcomes, but make sure that our students are achieving them. And that's where this toolbox of assessments comes in that allows us to evaluate how our students are progressing. And some of these assessments are going to be our traditional assessments that we use in education. So, exams where we test knowledge, practical, examinations where we test skills. But there are more sophisticated and a greater array of assessments that are being developed, including things that they're called OSCEs. Those are objective, structured, clinical examinations where we can, in a valid and reliable way, assess students' clinical reasoning or clinical skills. And there's another assessment that many of us are now implementing, that this working group has helped design, which are called entrustable professional activities, or EPAs. And you can see that the working group has come up with 8 to get us started with. And an EPA, and again, I'll read you our definition, is an essential task. So this is 8 different tasks of a discipline that a learner can be trusted, here's the key part, to perform with limited supervision in a given context and regulatory requirements, once sufficient competence has been demonstrated. So what we're going for with these EPAs is to say, okay, we want our graduates to achieve a level of ability in these different tasks where we would trust them upon graduation to be able to go out and perform with minimal supervision. And so, for example, number 2 is to develop a diagnostic plan, um, um, and interpret results of diagnostic tests. So that is an example of really a complex behavior that involves many competencies, many skills, a lot of baseline knowledge in order to be able to do this. And we want to be able to assess a student as they progress during their training in being able to perform this complex task.
Our current model of medical education across the health professions, medical school, dental school, nurse, all of these health professions, is based on the Flexner report of 1910. So, we're still generally using that model, and it was based on 2 years of preclinical sciences and then 2 years of clinical work was generally the agreed upon framework. And for most of those the past 110 years, there's been a pretty rigid line there. You got to sit in class for the first 2 years, get all the ologies into your brain and recall all those facts and take all those tests. And then we're going to let you into clinics and do other stuff. Well, again, over the last 20 years or so, there's been a dramatic shift in the schools to introduce clinical hands-on training much earlier in the curriculum. Some schools have been doing that more and earlier, but every school is doing more of it now. So I think it's a really important part. And again, the competency-based framework is the tool that will facilitate being able to do that. And as Dr. Michelle mentioned, getting the assessment down correctly too. So it's a really big deal.
The next topic discussed during our summit pertained to mental health and the significance of promoting industry-wide programs that focus on well-being. Our experts expounded upon ways that veterinary colleges are providing support to their students and their staffs, as well as educating future veterinary professionals on the significance of personal health for themselves and their teams. This is a critical issue in which the veterinary profession has emerged as a leader in acknowledging and proactively addressing this subject. Dr. McCabe begins. We then hear from Ms. Kaur, and finally from me.
Certainly, well-being in general has emerged as an incredibly important part of what we do across the entire profession. So it's not just students. We recognize that there are problems with interns, residents, faculty at our colleges, as well as throughout the profession, and indeed in the veterinary nursing and technician field as well. So this effort began in earnest about 6 or so years ago, when several of the associate deans for academic affairs were noting an increase in the number of students that were having some extreme difficulty and some mental health concerns. And from that arose a series of summits on well-being in the schools. And that in turn rose up to an effort across the whole profession. Here's what we know. Is that we are not alone. These issues are affecting all of the health professions. and in other aspects of other sectors of society as well. But certainly in medicine and dentistry and nursing and even in social work, you know, the ones that the people who are trained to help people deal with these issues are having their own issues. So that's what we've learned is we're not alone, and we do work with the other health professions to adopt evidence-based practices to deal with these types of things. Number two is that we've also learned that this is not a new phenomenon. The fact is it's always been there, we just didn't talk about it. That's the reality. So because we are now intentionally focusing on this issue and destigmatizing the issues associated with mental health and well-being, and we are encouraging students and faculty, and I hope those of you in the private practice sector are encouraging it within your own teams, for people to identify and acknowledge and keep track of their own well-being and their own mental health. It's a really important aspect of just general well-being, and one that we too often overlook. So what we're trying to do in the schools generally is to model the behavior that we want our graduates to adopt. One of the big challenges we have is the so-called hidden curriculum. So we have the written curriculum, the open curriculum, the acknowledged curriculum. This is what we're teaching you, and we want you to do it this way. But then on the other hand, we model different behaviors. So for instance, in the clinics, when we have a faculty member who says, well, when I went to school, I worked 100 hours a week, you know, that's how you do it. That's not the message we want to send our graduates. We want people to recognize the signals that they have about dealing with stress and anxiety, and we want them to deal with them in a healthy and productive way. Again, most of what has been happening in the past is people deal with these things in unproductive ways, typically with medication or alcohol or inappropriate behavior. And again, we cannot address this problem unless we acknowledge it and deal with it forthrightly. To that end, AAVMC, we just hired a permanent full-time director for well-being. We're the first of the health professions education associations to do that. I expect others will follow given the progress that we've made in this area. Mackenzie Peterson was formerly on the staff at Cornell. She's still in Ithaca, but she is now working full-time for us, and she's working across all of the schools with the mental health professionals and providers that are working in our colleges to help them share their ideas, their best practices, to develop a support network for them, but also to develop the literature, the evidence that we need to develop programs at our schools.
I would love to jump in here because this is actually something that we are very aware of and pay a lot of attention to in the program at Harcum. And I would say it was probably on our radar for a slightly different reason years before, because one of the things that NAVTA identified in surveys was the very short professional life on average of veterinary technicians in this country, which was really about 5 years, and then people tend to leave the profession. And so we wanted to look at why is this happening, and it parallels pretty closely with what we see in veterinarians as well. You know, people not coming out of school with student debt, being under that kind of pressure, the emotional burnout that we experience in this profession. And compassion fatigue is where we start addressing it with the students, and we make sure that they understand what that concept means right away in their first semester. And we have really focused on mental health issues, self-care. One of my greatest assets and resources in running the program at Harcum are our alumni. And we actually have an alumni in the area who got her the practice where she worked to make part of her job being dealing with self-care and getting people to be talking about these issues in her practice. And she does come in and talk to our students as well. We also have utilized the other areas of support at Harcum. So we have counseling available to the students for free if they need it. We have student support services, and whether it's a mental health issue or just that overwhelmed feeling, because while they are students at Harcum is usually the first time they go into a clinical setting. And it's a, we have to keep in mind, like, that first experience with euthanasia can be devastating for some students, and they need to talk about that, the first, because they're usually in a secondary role witnessing a euthanasia and witnessing a client's response and the clinician's response. So there's a lot to unpack for us with our students, and we're just very aware of it and spend a lot of time on it.
LMU, because of its being, not in one location at any one time, or students spending a long time on campus, they're normally out in the field. And so we have kind of two levels of care, if you will, above and beyond folks like me on the clinical relations team who work with the students literally on a day-to-day basis. So we have clinical course mentors who are monitoring the work that the students are doing, but the students must put in reflections every day. And if there are ever any concerns about those students having stresses at home or stresses at the hospital or anything like that, the clinical course mentors immediately intervene, either getting us involved or offering our counseling services. We also have hub liaisons that physically visit the students at their clinical rotation sites, and they check in with the student, and they also check in with the preceptor, the mentor there, to make sure that things are going okay. We make sure their commutes aren't horrifying, their housing situations are all right, they're not working too many hours, because we know that all of those factors, both their personal and professional aspects, will add to their stress levels. And so we try to minimize that stress on them as they're out in their clinical rotations as possible, as much as possible. Of course, COVID has interfered a little bit with that, because we're not always able to do the physical touch points with them, but we still always have the means of communication through their reflections and their other types of communications with their clinical course mentors, who really keep tabs on that so that they're not experiencing any kind of stress, burnout, compassion fatigue, thoughts of any kind of issues where they may harm themselves. All of that gets recorded and reported.
Veterinary medicine is most assuredly a team-based profession, but often the roles of the team members are not clearly defined, nor is each team member utilized or respected to the degree they should be. This area of concern was sparked by a question from one of our attendees, who drew attention to a technician shortage and asked how education is being more supportive of this problem. In the discussion that ensued, the panel focused on improving the dynamic of the team in veterinary medicine and reviewed how to value the support staff, encourage professional development, and thus educate on the concept of interprofessional collaboration. This started the conversation on what can be done to continue developing and retaining educated, skilled, certified staff members. Ms. Kaur, Dr. McCabe, and Dr. Michelle all shared their opinions on this subject.
I can tell you from a NAVTA point of view, and I can tell you from my from a PVMA point of view, and my small role as the program director at HARCOM, I think we need to value our veterinary nurses, and we need to focus on utilization and creating a system where people can make a living wage as a veterinary nurse and have room to grow in the profession. And these are all things that the Veterinary Nurse Initiative does touch upon in one way or another, and why I'm fairly passionate about it and think that it's very important. This is a conversation I could have all day, but I think if I had to highlight what do we need to be doing, better utilization, and I think for veterinarians, better understanding of what a licensed veterinary technician can bring to your practice, both in the way of generating revenue and also creating time for you to breathe and maybe do a little bit of self-care. But I think there's so much that we could be doing right now that maybe we're not.
I'm excited to let everybody know here, we haven't done much publicly yet, but that there's a new executive director at NAVTA, and also a new-ish executive director within the last 6 to 8 months at AVTE, the Association of Veterinary Technician Educators. So just like my association, AAVMC, represents the educators and the faculty at our veterinary colleges, there's another association, AVTE, that represents educators at the technician programs. And what we know is, as Kathy has mentioned, is that there's a high turnover rate, a very short time in the profession that technicians have, right? 3 to 5 years, an incredible number leave. And it's creating shortages and significant problems for the profession and the ability to deliver care. So we recognize that we need to do a better job of training veterinary students to work with technicians so that when they graduate, they are prepared to work in a team-based environment. And that's what we're focusing on, is that terminology, team-based. So veterinarians need to be team members to work with technicians and the office staff and the business managers and all of that. We can no longer be educating in isolation and then saying, we'll figure that out when you get out into practice. And I do think, as Kathy mentioned, that one part of the solution is for veterinary technicians and nurses to be utilized at the maximum ability of their license and their capabilities and their skills. And frankly, we still don't do a good enough job of, and it makes such good sense. It's good business, first of all, and you can provide higher quality care to more clients and more patients if you utilize technicians properly. So we've got some work to do, but I'm excited to let you know that we're developing these relationships with these at our association level, and we're hoping to get that impacted into the colleges.
We so deeply value our nursing colleagues. We know how talented they are, and one of the things that I just wanted to comment on, though we do recognize that this is a real difficult thing in this profession, is to retain these colleagues. And it is it's not just a matter of addressing, though it's really important to address working conditions, living wage, and things like that. We have had to reinvigorate, and I think I'm glad we have our professional development for our employees, for our nursing employees. So that's such an incredibly important part of retaining these really talented individuals, is to give them a place for growth and career development. So I think that I want to echo what you said there, that professional development is a really key thing to have for veterinary technicians. The other thing I wanted to just point out here in a more global way is I didn't take a screenshot of it, but if you look at that competency-based framework, you will see that competency number 6 is collaboration. And we consider this a key competency, for veterinarians, and so as I'm just going to read to you the definition. The graduate collaborates with diverse colleagues, clients, and other stakeholders, and demonstrates skills as a leader and interprofessional team member to improve outcomes and reduce error. So that interprofessional, collaboration, we think is a key competency in training, our students. I hopefully this is going to pay dividends for our students and our graduates in the future to take this approach.
Our last topic broached the similarities as well as the differences between externships and internships, and what the influence of each of these programs does for education within the pre- and post-graduate years. We also touched on the ways we can support students progressing through each of these endeavors and the impact of those outcomes as our profession continues to grow and specialize. You will now hear comments from me as well as those from Dr. McCabe.
Since all of the students from LMU's College of Veterinary Medicine do what are traditionally known as externships, I feel that the difference, to me at least, is pretty apparent. But an internship is something that's usually done on a more formal basis. Post-graduation, students are applying most frequently through the VIRMP to a variety of different sites that offer registered intern experiences, which normally are rotating internships through multiple different specialties, either at an established teaching hospital or at a very large referral practice that has multiple different specialties affiliated with it. Externships, though, on the other hand, are again, areas where the students still in their 4-year program of veterinary school are normally going to an outside site, whether all of their education is done through externships, which could be 2 weeks long, 3 weeks long, 4 weeks long. I mean, there's a variety of different lengths, but they're going to different sites and experiencing different aspects of veterinary medicine. So possibly at a zoo, possibly at a diagnostic lab, possibly at a pharmaceutical company or with the CDC. So there's so many different experiences that these students can have depending on what their interest is in the profession. And in general, we would hope that most practitioners, especially those of you who are on the call, would be willing to take an extern student, again, in that pay it forward sort of way, like, how can I help the students of tomorrow get a good education today? So externships will contribute to that graduate before graduation, and internships will be those types of students going on for further education post-graduation. And oftentimes those internships lead a student to the potential of applying for residencies and so forth. And you're not necessarily going to be seeing interns in your own program unless you're at a specialty hospital. But externships for sure, you know, and whatever experiences you can offer students from Penn Vet or from Tufts or Cornell or LMU are all going to be great experiences contributing to their education.
A couple things I can just add based on some other developments. So as Tina said, the externship occurs during the 4-year professional program prior to graduation. They tend to be short in nature, 2, 3, 4 weeks, something like that. And all of the US and Canadian schools, so they've always allowed students to do a certain number of these experiences off campus. What's emerging as a model in veterinary medical education, as well as in human medicine, is a more fully distributed clinical training. The first school in the US to do that was the Western University of Health Sciences. And in that case, 4th-year students spend 100% of their clinical year off campus in highly supervised clinical experiences. So the college, the faculty still oversees these things, but they are community-based. They're private sector practices, or they're done at other teaching hospitals at other universities. Lincoln Memorial, as Tina well knows, also follows that model. The 2 newest schools that have been accredited by or pre-accredited by the Council on Education, the University of Arizona in Tucson and Long Island University, will also follow that model. University of Calgary also uses that distributed model. Internships, as she mentioned, is about, many people think of it as a 5th year of school, except you get paid for it, but it tends to be a slightly lower wage than you would get as being hired as an associate. About 35% of our graduates go into typically a 1-year rotating internship. Many of those are seeking a residency to get board certified in a given specialty. Although given that the number of residency positions, whether they're in internal medicine, surgery, or any of the other 20-some recognized specialties, is very small, the majority of those students who do an internship do not ultimately get into a residency. So there's a little bit of some concern has been raised about some of the quality of these internships, including the number of hours that recent graduates work, that these graduates work in those practices. About a year or so ago, the AVMC developed guidelines, and it talks about, defining what an internship is, that it has to be primarily focused on providing a mentored educational opportunity for the graduate, for the employee. It's not meant to be a way to hire a new associate on the cheap and make them work really hard. So we just want to be sure that that these things continue to achieve those goals.
On behalf of the Pennsylvania Veterinary Medical Association, and speaking for the panelists who participated in our summit, I want to thank you all for joining us today. These are topics that will continue to evolve as we stay attuned to the changing needs and interaction of our students, faculties, and working professionals. This summit humbly served as a springboard for conversations that bring to light opportunities to progress and evolve as an industry, which will always be in demand, will always need to interact with the public, and will always be a leader. As an educator and a PVMA member myself, I trust this will be a dialogue that will reach far beyond the COVID-19 crisis. My hope also is that this summit overview sparks even deeper discussion at the Veterinary Leadership Conference as well. Should any of you have questions, please feel free to reach out to the PVMA staff to get in contact with any of the panelists. Thank you.